babies born to opiate-addicted mothers have reached its peak. The increase in the number of people affected by the opioid epidemic has been causing worry to health officials. Now, officials have another reason to be alarmed since it was revealed that the epidemic is increasingly affecting newborn babies. The most commonly abused opioids include prescription painkillers like Oxycontin, Vicodin, Percocet, and fentanyl. Illicit opioids like heroin are also in the list. The CDC team said better addiction prevention efforts are needed to reduce inappropriate prescribing and dispensing of opioids to curb this increase in what's medically known as neonatal abstinence syndrome. USA Today reported that babies born with neonatal abstinence syndrome, NAS, and experience withdrawal at birth. They often experience vomiting, diarrhea, seizures, feeding difficulties and even respiratory distress at times. According to healthday.com, NAS is the most common effect of opiate exposure. The increase in the incidence of NAS follows the ongoing heroin epidemic and the rise in the supply of prescription opioids. While other forms of maternal drug addiction can cause the syndrome, it is most often attributed to in utero opioid exposure, said the team led by Jean Coe, of the CDC's National Center for Chronic Disease Prevention and Health Promotion. For the study, the team collected and used data from 28 states under the supervision of the CDC. It was revealed that the number of babies born dependent on drugs increased to 300% between 1999 and 2013. From 1.5 cases every 1,000 births in 1999 to 6 cases per 1,000 by 2013. It was also found that there are several states who have been suffering from this crisis. The study also revealed that the state of Hawaii has the lowest number of NAS cases, 0.05 cases per 1,000. However, 3 states, Maine, Vermont and West Virginia were found to have more than 30 cases of NAS every 1,000 by 2013. West Virginia was the worst off. By 2013, that state's hospitals diagnosed the syndrome in more than 33 babies for every 1,000 delivered, the CDC report found. The study authors also found that in 2012 alone, Medicaid programs were financially responsible for approximately 80% of the estimated $1.5 billion in abstinence syndrome-related annual hospital charges nationwide. Coe's team believe that preventing women of childbearing age from getting hooked on opioid is key. UPI.com said that since most of the people who are hooked on the drugs suffered from addiction after seeking treatment for chronic pain, doctors should consider non-opioid drug therapy first.